My name is Katie Wiedman, and this is my dissementation video. The mission of Dignity Healthcare Organization is all about human kindness. They were founded by the Sisters of Mercy, and they made a promise to help all people that were sick, that had a lack of education, or those that were experiencing poverty. They state that human kindness heals the mind, body, and spirit. Their mission states that common spirit health makes the healing presence of God known in our world by improving the health of all people that we serve, especially those that are vulnerable, while advancing social justice for all. Their values include compassion, inclusion, integrity, excellence, and collaboration. Collaboration is key in a healthcare organization. The University of Minnesota shares that improving communication within a healthcare organization strengthens crisis management, ensures that resources are being used effectively, ensures compliance of regulations, facilitates effective team coordination, streamlines operation, and leads to better decision-making. On the other hand, ineffective communication, for example, can lead to medical errors due to misdiagnosis, which may also lead to life-threatening complications for our patients. The quality team at Dignity Health shares that miscommunications may be seen in handoffs, for example. Miscommunications can occur in any area of healthcare organization, and when they do happen, they can affect the ability of the organization to reach their goals. After attending several meetings at Dignity Health, I noticed that though there was collaboration, it seemed as though it were not enough. Communication seemed to have an effect on patient care in areas of workflows and the allocation of resources. The revenue cycle can use some more effective communication with the way authorizations are handled and transparency with the payers that we are in and out of network with and why. The organization as a whole can use more transparency in an employee's role. For patient care, we need to ask ourselves, how can we improve communication to better serve our patients? In the revenue cycle, we can ask, how can we collaborate more effectively to reduce the number of rejections and have a better understanding of the revenue cycle as a whole? And across the board, we can ask, how can we improve communication so that our employees have a clear understanding of their role while feeling valued and successful within the organization? The goal for this implementation in regards to patient care would be to decrease the number of incident reports due to ineffective communication. Ineffective communication can be seen in handoffs and allocation of resources and in workflows. For example, when there's a construction project in the cardiac catheterization lab at a major hospital, we need to ensure that the procedure rooms meet safety standards before allowing cases to happen within that resource. For the revenue cycle, the goal would be to decrease rejections by improving collaboration within the registration and authorization departments. There's a lot of confusion on how to complete authorizations successfully and who we are in and out of network with. Finally, for the organization as a whole, the goals for everyone would be knowing their role within the organization, making sure that every employee feels valued and knows how to succeed and be promoted within the organization if they wish to do so. To accomplish these goals, the plan would be to implement a quarterly CFR to improve communication across the board. What a better way to show human kindness than by sharing the organization's values, and this implementation will do just that. A CFR is an acronym for a communication resource called Conversation, Feedback, and Recognition. An OKR is an acronym for Objective and Key Results. OKRs are organizational goals. They include an objective and key results. CFRs complement them by gathering feedback in a timely manner from employees. Recognizing your employees' performance as you reach your KPIs will boost the performance of the organization. To measure the outcomes after the implementation of the CFRs, we will use patient safety indicators to measure and assess the incidence of adverse events and in-hospital complications and identify issues that we may need to study a little bit further. For the revenue cycle, we will see if the CFRs impact rejections by reviewing them with the revenue cycle manager. To see if communication has improved within the organization as a whole, a survey will be conducted with SurveyMonkey for all employees to see how their experiences with the CFRs has had an impact on their communication interprofessionally within the organization. To ensure sustainability, the CFRs will be implemented quarterly to improve communication. To maintain and revise the project's implementation, I will be monitoring the results every 6 months with the revenue cycle team, the quality team, and the leadership teams. And if these results are not successful, then I will decide if a revision should be made or if I will need to extend or discontinue the solution. If a change is made, I will address the stakeholders and we will collaborate on a new implementation. As the metrics for the project are set and continue to be monitored and reviewed, I am ensuring that we are meeting the needs of our stakeholders and showing the managers whether the resources are effectively being used within the organization. To evaluate the success of the project, we will determine if the CFRs have improved communication to the revenue cycle team, the quality team, and the leadership team. Though the quality team could not share specific data with me, Jasmine Shaw, the Quality Patient Safety Program Manager, states that improving communication can make a significant impact on improving patient outcomes. Denise Perea, the Business Office Auditor within Dignity Health, agrees that with their revenue cycle collaboration that they do monthly within the clinics, rejections do improve over time. According to Heather Mann at Venture Health, the effect that the CFR's impact has on their organization is by enhancing accountability, strengthening the manager guidance, driving performance and engagement and leadership. The stakeholders of this project include the Business Office Auditor, the Quality Patient Safety Manager, the leadership team, and the employees. Though I did not have a chance to speak with every employee, we can all agree that implementing a communication resource like a CFR will improve many areas of the healthcare organization. I have seen myself through this program that each employee brings value and education to their team, and that we can all learn from each other. One way I have seen this done is in a monthly unit meeting where teams collaborate on patient data and outcomes. Nurses, administrators, and physicians come together and analyze mortality rates, readmission rates, and stroke rates. Each team member discusses ways that they feel they can improve these rates, and they all learn from each other with effective interprofessional collaboration. For example, when they see a patient that had a poor outcome, they have discussed what happened to reduce that outcome and hopes to improve this in the future. Another area that I have seen this is with the revenue cycle. The administration team meets monthly with the revenue cycle team, and they look at rejections together and collaborate interprofessionally on how to fix them in the future. When there are errors in the enrollment process or in the registration process, this can cause a delay in money being received from insurance companies or total rejections in payments. When this happens, the patient may need to pay the full amount out of pocket. Effective interprofessional communication can keep this from happening in the future. Though each team does have a communication technique that they currently use, I feel that a CFR would only enhance their communication strategy. Unfortunately, I was not able to implement my project with Dignity Health. The next steps would be a handoff to the leadership team. The management team did express that they would like to implement a resource like this within the medical group. There's just not enough time to implement something like this into their schedules. They are already filling it within clinics and have meetings and other responsibilities that take up a majority of their days. I would hope to see the implementation streamlined into the organization as a whole, because the streamlining process for an organization is important, and it'll help ensure that communication will be more effective because the procedure will be transparent to everyone. When policies and procedures are not clear, it can make the outcome less favorable. In a healthcare organization, ineffective communication can lead to a decrease in profits, misdiagnosis, medical errors, and poor patient outcomes. Healthcare has changed so much since the organization has been founded in 1954, but one thing will never change: the world needs human kindness, and being able to collaborate effectively is just one way of sharing that with our patients and our healthcare organization. Thank you. Here are my references as well.